Welcome you to the Inspire London College. This is the assignment worksheet for Qualify Level 5 Diploma, the Management of Quality in Health and Social Care, with the unit number A5059521. So in this video, I'll guide you that how can you meet the requirement of this specific assignment by considering its own specific learning outcomes and assessment criteria. Now, here you see this is the introduction part in which you have to provide a brief introduction to the topic of your assignment, right? The topic of your assignment is management of quality in health and social care. So make sure that you briefly discuss what is the concept of quality in health and social care, what is the importance of quality in this sector, how can we ensure it, and how the implementation of quality can make the things even better. And keep your introduction part very concise and to the point under 150 words. Now, moving to the learning outcomes and assessment criteria. So here you can see on your screens, this is the learning outcome 1, in which you have to critically discuss different perspectives of quality in health and social care. Now you see here the word comes critically. So it's very important for you to provide the answer under any assessment criteria learning outcome by keeping in mind the keywords of the assessment criteria. So the word critically means that you have not only to discuss or explain the term that you're asked under the specific assessment criteria, but you have to uh, provide some reasons, some justifications, evaluate that in terms of like what is the positive points of that specific concept, what is the limitations, what is the impact of that on that specific sector. In this criteria, it is asked like the quality assurance in terms of health and social care. So you have to provide a balanced answer in which you need to discuss in terms of evaluation, like how and what this specific concept is. So make sure that while you are discussing any of the assessment criteria, you keep this in mind, the keyword of the assessment criteria, right? Now, this is the learning outcome 1 under which for the assessment criteria 1.1, in which you are asked to critically discuss the role of quality assurance in health and social care. Now, under this learning outcome, for this criteria, you have to first discuss like what quality assurance is, what is the importance of quality assurance, how does it help the organizations in order to ensure that the services they provide are very effective, they are safe for the service users, they are consistent. And you can also discuss like how it helped the organizations in order to meet the regulations or standards in the sector of health and social care. Whereas for the assessment criteria 1.2, you need to critically discuss two different models for ensuring the quality improvement. Now, under this criteria, first you need to identify different models that are used for the improvement of the quality. And then you need to choose any of the two different models that you think can play a major role, a better role in improving the quality of the health and social care sector. And for the evaluation purpose, you can discuss like what each model is, how explain how it works. You can also discuss the effectiveness of each model, what are its key principles, how it makes improvement, what is the steps that is used by that specific model in terms of improving the quality. And you can also even compare these two models that you have choose in terms of discussing their strengths, in terms of discussing their weaknesses. So this is how you can provide an effective answer under the assessment criteria 1.2. Now, moving to the learning outcome 2, which is critically analyze the strategies for achieving quality in health and social care services, in which for the assessment criteria 2.1, where you need to analyze the role of Care Quality Commission in maintaining quality in health and social care. So for this assessment criteria, you are required to discuss the role of the Care Quality Commission, right? You can discuss like what they actually do and how they actually do their activities, like how they monitor their services in terms of improving the quality, how they carry out their inspections and promote improvements in health and social care, sectors. And while discussing their roles, you can also discuss like what impact do their inspections and what impact do their roles have in terms of improving the overall quality of health and social care. Whereas for the assessment criteria 1.2, in which you need to analyze the role of benchmarks in maintaining quality in health and social care. So, in this criteria, first you need to understand the concept of benchmark, like what benchmarks is, and then you need to analyze like what is the role of these benchmarks in terms of helping the organizations in order to see like how well they are doing compared to their competitors or compared to others in the market in the same field like health and social care. And you can also discuss like how these benchmarks help the organizations in terms of identifying any areas for the improvement purposes, or how these help the organizations to track their progress with time for the improvement purposes. And then moving to the learning outcome 3, under which for the assessment criteria 3.1, you need to evaluate the methods by which the health and social care can gather the feedback to improve the quality. So, under this criteria, you are required to identify and evaluate different ways or different methods that can be used in terms of collecting the feedback from others. Like you may consider like this, it could be the surveys, it could be conducting interviews with the service users, or analyzing, evaluating the complaints of the service users, or you can also consider like the analysis of the online reviews provided by the service users. So these are all the points you may consider under this assessment criteria in terms of evaluating the methods by which the health and social care can gather the feedback from others. And further, you can also discuss like how these specific ways or how these specific methods can be used in terms of improving the overall quality, like what are their strengths, what are their weaknesses, and how using these ways can effectively make real improvement to the services. Whereas for the assessment criteria 3.2, you need to identify the stakeholders in the improvement of the quality delivery in health and social care. So, in this criteria, you need to identify like what are different stakeholders that play their part, that play their role in terms of improving the quality delivery. So in this, you may not just consider like the service users themselves, but their families, the carers who provide them the care. It can also include the managers and the leaders of the organizations, or some regulatory bodies, or even the wider community. So you just need to identify these stakeholders that play their roles in terms of quality improvement in the overall health and social care sector. And last but not the least, assessment criteria 3.3, in which you need to evaluate the strategies that can be used to improve the service users' safety. So, under this criteria, you are required to discuss some strategies that different organizations can use in terms of protecting their service users from any harm. And in terms of these strategies, you may consider discussing like the implementation of safeguarding policies, training staff, and developing different effective communication protocols. So these could be the strategies, and you're not bound to only discuss these. It's up to you. You have to search by your own, like what are the different strategies that can be used by the health and social care organizations in order to protect, in order to enhance the safety of their service users. So once you have discussed these assessment criteria and learning outcomes, as you provide a very short introduction to your assignment, you also have to provide a brief conclusion to the topic of your assignment as well, in which you can discuss like what are the main points, what were the main points of the whole of your assignment within 150 words. And lastly, this is the bibliography section, in which you have to provide the references of the sources that you use for collecting the information for the whole of your assignment. And make sure that you provide these references in proper Harvard referencing style. So this is the end of the assignment worksheet of Qualify Level 5 Diploma in the Management of Quality in Health and Social Care.